Fellow Ghanaians, today is World AIDS Day, and we're joining the rest of the world to mark it. World AIDS Day was established in 1998 to bring people together to express solidarity with persons living with HIV and to remember those who have died from AIDS-related illnesses. It is also a time to assess the national performance in responding to the pandemic and re-strategize to end AIDS. This year, we're marking the day under the theme End Inequalities, End AIDS, End Pandemics. As co-chair of the group of eminent advocates for the 2030 United Nations Sustainable Development Goals, SDGs, I know that this theme is a key aspiration of the SDGs. This means our diligent pursuit of the SDGs should position us favorably to ending the inequalities fueled by AIDS and other pandemics. As rightly pointed out by the UNAIDS, the Joint United Nations Program on HIV/AIDS, and I quote, "Today, the world is off track from delivering on the shared commitment to end AIDS by 2030, not because of a lack of knowledge or tools to beat AIDS, but because of structural inequalities that obstruct proven solutions to HIV prevention and treatment," unquote. Indeed, gender inequalities, stigma and discrimination associated with populations at higher risk of HIV prevent people from accessing prevention and treatment services. Gender inequality is a major reason for the disproportionate disease burden on women and girls. 2 out of 3 Ghanaians living with HIV are women, whilst 4 out of 5 new infections in young people aged 15 to 24 years are adolescent girls and young women. It is extremely troubling that adolescent girls and young women account for 28% of total HIV new infections in the country. For us to end AIDS, we must eliminate inequalities and discrimination in every form of its manifestation, such as domestic and gender-based violence, harmful, outmoded traditional practices like widowhood rights and child marriage. Promotion of girl-child education must be an integral part of reducing gender inequality, as the completion of secondary school by girls is reported to reduce new HIV infections in adolescent girls and young women by some 50%. The free senior high school, free SHS policy has not only achieved higher enrollment of girls, but will ultimately contribute to a significant reduction in new HIV infections among adolescent girls and young women if they adopt and maintain risk reduction behaviors, which they are more likely to do. Fellow Ghanaians, we are all aware of the extreme difficulties the world has been plunged into by the deadly COVID-19 pandemic in the last 2 years, and our nation has not been spared its devastating effects. We've had to make unpleasant but necessary adjustments to our lives in order to control the pandemic. As we are entering the 3rd year of COVID-19, we also begin the 5th decade of the HIV and AIDS pandemic. The experience of the last 2 years clearly shows that COVID-19 is reversing the gains made from 4 decades of HIV response. COVID-19 has disrupted HIV testing, prevention, and treatment services in Ghana. It is for this reason that the Ghana Health Service swiftly instituted multi-month dispensing of HIV drugs to prevent frequent visits to hospitals by persons living with HIV. However, the intervention was quickly undermined by supply chain challenges, leading to commodity shortages and further reducing access to services. At the continental level, COVID-19 has severely undermined the ability of African governments to mobilize adequate revenue to meet their health budgets. UNAIDS reports that ending AIDS is already slipping back in West and Central Africa. And with COVID still present, we face a serious challenge in winning the fight against HIV/AIDS. We cannot afford to see the significant gains achieved in the HIV and AIDS response reversed. We have the knowledge, tools, and the partnerships to end AIDS, and government is fully committed to ending AIDS by 2030. I'm fully aware of underfunding of AIDS programs, with donor expectation that government must fill the funding gap. The need for investing more domestic resources in HIV financing comes at a time that we face limited fiscal space, low revenues, rising debt payments, and crippling emergency expenditures for COVID response. Government has nonetheless accepted the challenge to increase domestic resources through the operationalization of the National HIV and AIDS Fund. This fund will not only ensure adequate domestic resources for the HIV and AIDS response, but will also make the national response financially self-reliant on a sustainable basis. The paperwork necessary for cabinet consideration has been prepared by the Ghana AIDS Commission and will be brought before cabinet shortly. Ending AIDS is highly possible and within reach if we apply the current knowledge and tools available to us, whilst every person takes responsibility for preventing new HIV infections. Science has made available testing, prevention, and treatment tools that enable us to end HIV/AIDS faster, even before HIV vaccine and functional cures become available. We must continue to use the technical guidance proffered by the World Health Organization, UNAIDS, the Centers for Disease Control and Prevention, to deliver effective testing, prevention, and treatment services. Ending AIDS and achieving epidemic control are the goals of the National HIV and AIDS Strategic Plan 2021-2025. These goals are to be achieved by reaching the 95-95-95 fast-track testing and treatment targets, which requires that by 2025, 95% of all persons living with HIV in the country must be diagnosed. 95% of the people diagnosed must be placed on antiretroviral treatment. And 95% of people on antiretroviral treatment must be virally suppressed. Eswatini and Switzerland have achieved these goals, and many African countries are on a track to achieving soon. For Ghana to join these countries, the National Strategic Plan seeks to reduce new infections and AIDS deaths by 85%, as well as eliminate mother-to-child transmission. The strategy ensures that prevention, testing, and treatment are given as a comprehensive package through standard models of differentiated services to ensure that groups, communities, and individuals receive tailor-made services that meet their specific needs. The strategy also seeks to achieve transformative results with demonstrable speed, urgency, and intensity of implementation. This national strategy should guide the multi-sectoral response, and I'm confident that if all stakeholders work together in implementing this plan, Ghana shall surely join the countries that have achieved HIV epidemic control. I want to use this opportunity to thank our founding partners, the Global Fund to Fight AIDS, Tuberculosis and Malaria, PEPFAR, and the UN agencies for their continued financial and technical support. I say AICO to the numerous implementing partners, notably the Ghana Health Service, Christian Health Association of Ghana, Webcast, and John Snow Incorporated. Accordingly, ladies and gentlemen, fellow Ghanaians, I declare the National HIV and AIDS Strategic Plan 2021-2025 duly launched. May God bless us all and our homeland Ghana and make her great and strong. And thank you for your attention.